All right, it is 4 o'clock on Thursday. We've got a full agenda here today, a number of different things for us to discuss. But let's start the way we always start, by reminding ourselves, and if you need to, say it out loud, that we're going to get through this, and we're going to get through this together. So we're going to get through this, we're going to get through this together. And I think that's really important, because by now we all know someone that we care about, that we're close to, that is fighting this virus or has fought this virus. And as things progress, we will probably all eventually know somebody that we have lost to this virus. Now, this is going to be a month where I hope we turn things around, but based on July, and we're still going to see a lot of pain. So let's make sure that we protect and preserve our mental and emotional health, that we stay as committed as we've always been to defeating this virus, and we step it up. We make sure that we are wearing our facial coverings, that we are doing our part to defeat COVID-19, because as you'll see again in today's numbers, we do believe the facial coverings are having a real impact. But first, let's start with some good economic news, at least for some of our cities out there. Today, the Kentucky Infrastructure Authority held their monthly board meeting to approve loans for local communities to improve water and wastewater systems. My belief is that every Kentuckian deserves clean drinking water and ought to have a safe water supply in both the water lines coming in and the wastewater going out. And this is a part of our infrastructure, and so many communities across Kentucky we've got to work on, whether it's aging infrastructure or making sure we reach people that currently aren't reached by these systems. So I'm happy to announce the approval of 5 loans totaling more than $7 million for the cities of Bardstown, Calvert City, Dawson Springs, I know that one well, Lewisburg, and Whitesburg. Bardstown was approved for nearly $1.5 million loan. It's going to use it to improve the wastewater system by increasing the capacity of 3 pump stations, updating access roads, and more. These upgrades will help stations meet demand while making them safe and providing better service to 8,000 Kentucky households. Calvert City was approved for a loan totaling more than $2.9 million. They plan to rehabilitate their wastewater treatment plant to improve disinfection, aeration, and mixing systems. Their update will create more reliable service for 1,700 Kentucky households. Dawson Springs was approved for a $1 million loan to make clarifier improvements to their wastewater treatment plant to improve sewer lines. And it will better serve 800 sewer customers and 950 water customers living in one of the best small towns across America. Lewisburg was approved for a $750,000 loan to rehabilitate approximately 2,600 linear feet of sanitary sewer lines and 14 manholes. This is going to improve service for 360 Kentucky households. As you can see, they add up. These are folks that are going to have better service. It's healthier for all of us. Make sure we meet that basic human right of clean water. Whitesburg was approved for $1.1 million loan to replace 2 water tanks to increase storage and improve the system that'll allow the city to wholesale water to the Letcher County Water and Sewer District. I am very encouraged by these investments in infrastructure, by the state and these cities being able to work together to improve their communities, and it's going to help us to reach our goal of a quality life for every Kentuckian by providing more reliable water and sewer access today to more than 12,000 Kentucky households. I think that is a big win for us, and we've got to make sure that we continue to invest. Second piece today, we've answered questions about it, but we're going to go ahead and make it official and let Kentuckians know that we're going to extend that facial covering mandate for another 30 days. Can you show the graph that we've been using? It's working. It's working. And since we made it mandatory, more people are wearing them. We are ahead this week. We have fewer cases this week through Thursday. We'll talk about that in a minute than we did last week. We may not have any positive growth this week, just overall cases compared to last week. It's working. And if we want to get some things back open that we had to pause, if we want to continue to grow our economy, this is our way. So just want to make sure that people know that for the near future, we're going to have to do this. We're going to do it 30 days at a time, but please don't require it to be mandatory just to do it. Do it because it's the right thing. Mask up KY. This is saving lives, saving our economy, and we hope will get us in a position to get our kids back in school. It is a small thing to do for such an important reward. All right, next big announcement, and we'll hear from the State Fair Board Chairman here in just a second, is on the State Fair. As we continue to fight the spread of COVID-19 in the Commonwealth, today we are announcing the Kentucky State Fair Board will limit this year's State Fair to participants only. Through consultations with public health officials, the Fair Board determined that limiting the fair to participants was a necessary step to prevent a surge in COVID-19 cases. This is something that the Fair Board came to, understanding it's their responsibility to protect Kentuckians, to create a safe atmosphere for everyone, and it's a decision that I fully support, and one that we were in consultation on, a decision that needed to be made. In an effort to manage crowds and social distancing, Lot A exhibits, midway concerts, entertainment, and food vendors will not be featured in this year's fair. By hosting a participant-only event, fair officials can more effectively enforce social distancing and facial covering requirements, as well as gather the necessary information to perform contact tracing. Kentucky State Fair will be held August 20th through the 30th at the Kentucky Expo Center in Louisville. The World Championship Horse Show will be held without spectators and will adhere to the U.S. Equestrian Federation's COVID-19 guidelines. I can say those are some very good guidelines, having a number of family members that participate in those equestrian activities. This decision is going to allow Kentucky to have a state fair when so many of our neighbors and others are not. It's going to allow us to continue a tradition that shows how important this is for us, while at the same time to take the necessary steps that we simply have to in the middle of COVID-19. Agriculture is one of the state's leading and most vital industries, contributing about $45.6 billion to Kentucky's economy last year. So this is a way to highlight it. Even if it's different, even if it's scaled down this year, we're making sure we're keeping that most important part of highlighting our farmers, our entire agriculture community, something that's so critical here in the Commonwealth and shows that our priorities are the health and safety of our folks, but also our agriculture community and economy. The State Fair Board has been committed to delivering a fair that's safe, and it's made me proud. It ought to make all Kentuckians proud. So here is our State Fair Board Chairman, Steve Wilson.
Thank you, Governor. Just to reiterate what you've just explained, we are going to be able to have the fair in the way that the Governor just described. This explicit details will be on our website immediately following the press conference. And I want to reiterate that we are going to require face masks. We will require employees who are handling cash payments to wear gloves. And only credentialed participants will be allowed in Freedom Hall and Broadbent Arena. So I just wanted to back up the Governor's comments and tell you that we are proud that we're having the fair, but obviously the health and safety of our community is uppermost in our minds. And we're just delighted that we're going to be able to at least have the horse show and the livestock contestants for the 4-Hers and FFA kids. Thank you, Governor.
I want to thank and express my gratitude to this Steve. Well, we might hear from the other one here in a minute, who is our board chairman, also the entire board, also David Beck, who is the CEO of Kentucky Venues, for continually monitoring where COVID-19 is, always having an open discussion on it, making these plans, and then making the responsible decision when the time came. This is a decision that I think was necessary and one that will allow us to have the fair in a safe manner. So let's get to today's report. Today's report, again, has more cases than we want, 516 new cases of COVID-19. But Monday through Thursday of this week as compared to last week, We've had 247 less cases, if my count here is right, and we're always looking at duplications. What that means is, at least in overall numbers, we appear to not just be slowing, but we hope stopping any escalation that we have seen. If these numbers continue, they are further evidence that wearing that facial covering, wearing that mask, is truly helping Kentucky in so many different ways. Our people, our economy, our kids, so let's keep it up. I believe if we continue to do it, we can potentially see even better numbers than this. These 516 new cases after duplicates are removed gets our state total to 33,254 cases since our first one on March the 6th. Total number of tests to date, 674,490. I believe that's 11,390 more than yesterday. Number of patients currently hospitalized, up to 701, and we are, at least anecdotally, hearing from a couple of hospital systems that they are seeing more people in the hospital. It's something that isn't unexpected given the large numbers in July, but something we ought to be pretty worried about, making sure, again, that we can help those that need it. And listen, this is COVID-19. If you're experiencing symptoms, if you're feeling under the weather, reach out to your doctor, call them on the phone, make sure that you talk to somebody earlier rather than later. Currently have 140 patients, Kentuckians, in the ICU, 8,523 Kentuckians recovered, and our positivity rate today is unchanged from yesterday at 5.51%. So I'd like to see that positivity rate go down. But again, we had so many cases and we had that escalation that we had to stop that it's going to take a little bit more work, I think, before we start seeing that number decrease, though I do expect if we can keep this trend up that we will see some decrease later this week. It's a 7-day rolling average, so sometimes there's a big number in the last 7 days that stays on. Sometimes there's a small number of one of those days that comes off and it impacts that overall average. New cases by county: Jefferson 148, Fayette 33, Warren 21, Madison 18, Callaway 15, Hardin 13, Bell 11, Graves 10, Oldham 10. Franklin and Laurel are both on here at 9. We've seen Franklin County at 9, I think, 2 straight days. I think they're noticing an uptick here. Thankfully, we have fewer kids today than the last couple days under 5 that have tested positive, but it's still more than I want to see. 12 kids under 5. Youngest this time is 10 months from all different counties: Knox, Cumberland, Hardin, Boone. Let's not listen to anything out there suggesting kids can't get this. They absolutely can, and they are. Wear your mask for these kids, for all our kids, for our parents, for everybody else. But this is a reminder that even the youngest amongst us can come down with this virus. Today, we are unfortunately announcing 8 new deaths of Kentuckians. That brings our total amount lost to 760 Kentuckians. And we'll put that in some context next week, but like I said, we've had major wars that we've gone through, at least in the last 40 years that we've lost, or maybe a little more than 40, definitely more than 40, that we've lost fewer than what we're going to lose to COVID-19. So let's remember that just because we don't see numbers like New York had or Florida is going to experience doesn't mean that this isn't hitting Kentucky really hard, and this ain't the flu. This is harming people in long-term ways and taking far too many folks from us. Let's treat it like it is. This is the pandemic of our lifetime, the Spanish flu of our century. Let's treat it seriously. Our 8 Kentuckians we've lost include a 68-year-old woman from Bell County, a 94-year-old man from Franklin County, 86-year-old woman from Fayette County, 78-year-old woman from Jefferson County, 84-year-old woman from Ohio County, 94-year-old woman from Franklin County, 68-year-old woman from Kenton County, and an 87-year-old man from Graves County. We continue to see more folks in their 60s, it seems, each and every week. Ethnicity and racial data is pretty much unchanged from yesterday when I read it out. It will be on our website. So we never want to lose 8 Kentuckians. We know that the deaths follow the large number of cases, and that we're going to have days it's going to be really hard to read that list, because it's probably going to be longer than this in the coming weeks. But I do feel hopeful, and I do feel optimistic that if we will continue to wear that facial coverings, that we have found a way to stop what was going to be devastating, and hopefully to not just reach a plateau, but to get back on the right track. And the reason is that Kentuckians are really doing it. Kentuckians are getting out there, they're wearing their facial coverings, and we've asked them to show it online. This Mask Up KY, Mask Up Kentucky, again, it's not a slogan or just a series of PSAs. It's what we need to do to protect each other and to survive, and I want us to show some joy in it. I want us to make sure that we're showing a positive example, so that we drown out the noise and people see people caring about each other, and the fact that while it's not comfortable, we can continue to do so much in our regular lives if we do it. So a little bit on social media. I like this, right? These are the kiddos at the playground showing that they can have this good experience outside. And remember, if you're outside and you're more than 6 feet apart, you can take that mask down, but when you get close like this, it's important, kids or adults, to pull it up. We appreciate them showing their spirit. Let's look at the next one. This is a pediatrician in Louisville, and I love that she is showing a little bit of her own style in her mask, but let's remember, for these pediatricians and for their patients, we were just talking about kids under 5, we ought to want to be wearing a mask. Protect her, protect those kids. And we appreciate her showing the importance of it. This is the Boyd County High School Band. They are doing band camp virtually this year. This is the power of the technology we have. You know, it's hard to feel blessed in the middle of a pandemic. But can you imagine how different this one is than the Spanish flu? That we have not just the amazing doctors that we just saw, we have more health information, we have ways like this to communicate and get out what we need to do, but we have ways to even have a band camp virtually. We have a way to not miss those opportunities that we would have in the past. None of us want to have to go through a 1 in every 100-year pandemic, but we are in a better place to deal with it than any generation in the history of this world. And so when we're feeling down, let's make sure that we know, in many ways, compared to those that have had to deal with these things in the past, we're blessed, and let's take the opportunities to protect each other and to make sure that we can still provide that enrichment to our kids, to their teachers. This one is a neat one. And one of the things I love most is seeing these videos that people are able to piece together, and you still hear that amazingly beautiful music. And here's the last one. This is St. Joe's that is thanking Family Dollar of Mount Sterling for cheering their folks up. Remember, early on we talked about doing a lot of things for our frontline healthcare workers, and I hope we still appreciate them the level that we should. That's not just wearing facial coverings. Let me mention another one. It's not going to the beach. I'm still hearing about people that work in places, even our jails or our prisons, where things can spread so quickly, going to the beach. I mean, going to the beach right now is like lining up a huge number of cars and somebody telling you that a machine gun is going to go off at some point while people are driving through. Why do it? You expose yourself to the risk of your own personal harm and harm to your family, and then bringing it back. So let's cancel those vacations. Let's be better people than that, knowing that it can harm the people around us. You put up the states. We'll update this again next week, but again, this is just a dangerous time to be traveling to these areas. It's not worth continuing your beach vacation if you come back and infect your church and your place of business and your friends around you. That is not worth it. And People could lose their lives, and certainly you infect a whole bunch of people around you, you could lose your friends too. So please don't do it. Long-term care facilities, again, we're showing active now and total cases, and so in a good sign today, we actually have 2 less residents on the active side, right, because we have people that recover over time. We like to see that going down. We have 9 additional staff on the active side. We don't like to see that going up. Cumulative cases, 24 additional residents, 54 additional staff, 1 additional death attributable to long-term care, 5 additional facilities, but facilities continue to make corrections to their data as they come in. A lot of this is done after the initial reporting, but this gives an idea not just of the totals that we've seen, but what the active challenge is as we face. And then our child care facilities, 3 new facilities with at least 1 COVID positive, 4 new staff, 2 new children, something we're going to monitor closely. Testing. I just want to make sure every day we're mentioning a couple of testing locations, and next week I want to highlight some that are around the state. I'm going to remind people, though, today of the St. Elizabeth testing site in northern Kentucky that is up and active and testing people today. We had a photograph of that, but I mainly want people to know how to sign up. And a second northern Kentucky spot opens up next week. Go to our website for this. Testing in the Louisville area with our partnership with U of L. A couple of those are already up and running. Others come up online. You can dial the number that's here on the screen. Go to our website to get that too. And then there is the Norton testing site as well. And then we're going to have information, I believe, for next week on additional testing in Lexington. I'm going to ask Latasha Buckner, my Chief of Staff, to come up and talk about some executive orders that we are renewing that provide some extra flexibility to Kentuckians.
Thank you, Governor. I have just a few updates and some reminders on the executive orders and a cabinet order or 2 that have been done to try to make life a little bit easier and a little bit safer during a challenging time. First, we've renewed our pharmaceuticals executive order. And as a reminder, this allowed people to be healthy at home by providing flexibility to pharmacists and Kentuckians who needed their medicine. So it meant that any pharmacist in Kentucky, in a Kentucky county, can dispense emergency refills for up to 30 days on medicine that is not a controlled substance to residents of any other county. Another renewed executive order is one prohibiting price gouging, and this is to keep unscrupulous people from taking advantage of Kentuckians during a difficult time. For instance, charging more for hand sanitizer, soap, cleansers, disinfectant, food, toilet paper, and some other things that we all need to be healthy at home. Furthermore, the Transportation Cabinet has put 2 orders in place. The first one extended driver's licenses that were to expire between the dates of March 16th and July 6th, both have passed now, but it gave you a 90-day extension from the date that it would have expired and allowed it to stay valid during that grace period. Most of that time is up, but some of those are still good through the end of September and October. The second order from Transportation Cabinet Secretary Jim Gray allowed that if your standard operator's license, your permit, or your ID was up for renewal between March 1st and September 30th, and you just need it renewed, you could renew it, or you must renew it now by mail or by drop box at your circuit court clerk's office. If you need more information on any of the driver's license related information, it's drive.ky.gov. Thank you.
I think next we're going to hear from Dr. Stack, our normal Steve. We had what's called a FIT team from the federal government that was in Kentucky the last several days. We had a number of meetings with them, and he's going to provide an update on their feedback.
Thank you, Governor. So the federal government well, all layers of government, the federal, the state, and the local, are important to our emergency response, and so we work in partnership across all layers. And we had a team, a federal interagency team, come from the federal government that included representatives from CDC, from FEMA, from HHS, from other agencies in the federal government. And they spent the last 3 days in the city of Louisville, Tuesday, Wednesday, and Thursday. My chief of staff, Kelly Alexander, helped organize the agenda. Dr. Sarah Moyer, the medical director, the health department director for Louisville Metro Health Department, helped organize their portion of it. And they did an intensive series of meetings over those 3 days, meeting with hospitals and homeless shelters and faith-based organizations and people who provide testing, a whole host of different things. And one of the benefits for this is to try to make sure we're maximizing our use of federal resources. Another one is to receive the outside impartial view of these career professionals from the federal government. And some of the responses they gave were that many of the things they saw being done here in Kentucky and in Louisville in particular represented best practices, which they'll recommend that other municipalities and states adopt around the country. That contact tracing is really good here, one of the best that they've seen. That our epidemiology and surveillance activities caused, the one member said he was blown away by how well done it was. And they commented consistently and repeatedly about how wonderful the collaborations were, that across layers of government and across community partners working with the health departments, how wonderful the collaborations were. They observed how it was very clear we'd all been in regular communication with each other, we're very familiar with each other. It was clear that this was not the first time we'd come together, and that was special and not something they see everywhere. And so I think my thanks go to Louisville, my chief of staff, and Mayor Fisher, who joined. Last two things they did point out, for the Battelle system, if you sterilize or clean your N95s, if you're a hospital, a dentist, a nursing home, anyone in healthcare or in the care of people who uses N95 masks, please go to kycovid19.ky.gov under the Healthcare Providers tab, and you'll see Battelle CDS system. Click on that and sign up. Even if you only send them 3 masks a week, they will clean them and they will send them back to you. Please make use of that. And my final thing and follow-up is thank you to the State Fair. I know it's difficult for all of our organizers to take these hard steps. I think they did the safe thing. I think they rose to the challenge for the greater good. For others, like the 127 yard sale participants this weekend, the Louisville Street Rod Nationals, please follow our guidance. Wear a mask, stay away from each other so you socially distance, and do proper hand and surface hygiene. This is absolutely essential. If we're going to enjoy these activities, we have to do them safely, and all of our responsibility begins with us and us taking this simple action. So thank you very much, Governor.
All right, on Monday, and it'll be before we have our next 4 o'clock, we will have new guidance and a new order out for bars and restaurants. While it hasn't been fully finalized, expectations ought to be that capacity will increase again to 50%, but there will be some changes. Certainly in restaurants, we need people to still prioritize outdoor seating. It is much safer, and we have seen a significant growth of it during these last 2 weeks, or what will be the full 2 weeks. Even though it's hot outside, it's important that restaurants don't move backwards on that, because again, everything we do is contingent on the virus. More outdoor seating keeps the virus down and will put us in a better position. Bars can expect to have a enforced seat rule. You go to a bar, expect to have a seat, expect to sit in it, expect not to get out of it unless you're going to the restroom. All the service and the orders need to be at a table that you come with the party that you are with. I know that's going to be a different experience, but it's about the only way that we think we can do it and do it safely at the moment. The other expectation ought to be that there is going to be a curfew, not that curfew for people to be in their homes, but that bars and restaurants Both are going to be expected to have their very last item served at 10 p.m. And then there's going to be about an hour to let people who were served at 10 p.m. consume and ultimately go home. We don't want somebody having a drink at 10:59 and getting in their car right afterwards. We don't want people getting in their car and driving regardless. But we'll have the specifics on that. We think that this gives us the best opportunity to avoid the mega spreading events, the super spreading events, and to encourage what we need to see from folks out there. Really important though, we can't exchange those later nights that might have been at an establishment for a house party. We're seeing this in other states. California or Los Angeles just put in an order where they're going to cut off water and sewer to properties that they're seeing these 100, 200, 300 person house parties for. That's going to prevent us from getting where we need to go, hurt our economy, hurt our ability to get our kids in school, so let's not do it. Now we got Michael Brown, who's going to give us an update on our efforts to contain this COVID spread in our prisons and to provide the very best care we can to those that we have a responsibility for.
Thank you, Governor. And let me give you a system-wide snapshot right now and then tell you what we're doing in a couple of specific places. To date, system-wide, we've had 844 positive cases with inmates and 136 with our employees. But we've also had 560 inmates recover and 87 employees recover, leaving today 49 active employee cases and 284 active inmate cases. Turning to 3 specific institutions, at the Kentucky State Reformatory at LaGrange, back on 7/27, we reported that we had 17 staff and 190 inmates tested positive. Today, that number is 19 staff and 217 inmates. And I would remind everybody that at KSR at LaGrange, it's our closest thing we have to a hospital prison. It's designed to hold those with extensive medical issues as well as mental health issues. And what we've done there is a similar thing that what I had described at Green River. The inmate population is separated by wing. Positive, those who are negative, those who have been negative but exposed. And they're in different wings. There's no interaction between those wings. In addition to that, those who are extremely medically fragile are housed either in our nursing care facility or in a separate dormitory. Luckily, we've had no positive cases come out of those 2 facilities, none of those extremes. 1 dormitory has already been converted to a medical unit for those who are recovering from COVID symptoms and require some more intense care. All meals and canteen items are delivered by staff to these wings. All the staff are using current PPE, including gowns, masks, etc. So we've seen a flattening of all of the things even at KSR. At KCIW, which we had a spike at before, topped out at 31 staff and 239 inmates. As of today, 22 of those staff and 190 of those inmates have recovered. And Green River, where we had our first big outbreak, happy to report that everyone at Green River, staff and inmates, are now recovered. Thank you, Governor.
Two quick final things, and then we'll open it up for questions. Number 1 is let's remember the basics. Hands, face, and space. That's how we defeat this virus. Wash our hands and don't touch other people. Make sure you wear that facial covering and don't touch your own face, and stay 6 feet apart. Dr. Stack says, and he is right, that we can't test our way out of this virus. We prevent the virus from spreading. So in everything we do, in everything we think about, hands, face, and space. And finally, I got an opportunity late this afternoon to talk to my friend, Governor Mike DeWine, who tested positive today for COVID-19. He is in good spirits. He told me they'll have to figure out how he came down with it, engaging in good practices, but I wish him a speedy recovery. He has been a strong ally in this fight against COVID-19, and I think it's just an example of how this virus can spread very aggressively, and let's keep him in our thoughts. So we'll open up to questions. I started on the right yesterday. We'll start on the left today with Nick.
We're speaking with some teachers that are a little frustrated that they're beginning their school year online, virtually, but they're still required to come to the school. So we've heard you talk a lot about if employees can safely work from home, employers let them do it. Your thoughts on this?
So the question is, with school districts, some of them starting virtually, it appears at least some of the schools or some of the school districts are still requiring individuals to come into the school. And we saw this a little bit when we had to stop in-person classes at the end of the last school year. My strong request to whether it's superintendents or principals is, I know that's the way things have always been done, but that doesn't mean it's a good reason to do it. We always hear that in state government. That always is the thing that, to me, is like nails on the chalkboard. That's the way we've always done it. In the middle of a pandemic, we have to do things differently. I believe that there are ways to keep up with your employees to make sure they are productive without requiring everybody to be in the building. There may be instances where some people need to be in the building, but everybody doesn't need to be in every single day, and that could be bad for people's health. So I'd ask anybody that is currently requiring that to strongly reconsider. Let's make sure we're doing this right. And if we want to get our kids back into school, why don't we start showing the good, strong, best practices that it's going to take with our kids, with our faculty and our teachers before they're here. Stu?
We're reporting 701 people hospitalized today. Previously, you said there were some cases coming from other states. Are you seeing many from Tennessee?
We don't have an exact number. There is a hospital system in Bowling Green that has been accepting some patients from Tennessee. I believe our 700 number, Dr. Stack, does that include people from other states or only Kentuckians? So it's whoever's admitted. We'll see if we can get a number of those that are from out of state. There's no question we have at least some, and we'd have to figure out exactly how much that is. Now, do I think it's 10% of the overall number? No, but it could be somewhere south of there. Nice to see you, Grace.
I was going to ask, first of all, there's a lot of frustration around Louisville about the Breonna Taylor and the length of time it's taking the AG to make a decision on up and down on the arrest. Have you talked to him, and do you have any personal thoughts about why this is taking so long?
I haven't said. The question is on the Breonna Taylor investigation, frustration about how long it's taking, and whether I've spoken personally to the AG about it. I haven't spoken personally to General Cameron about it. I do believe there have been conversations between our senior staff on this and some other issues. It has taken too long. Took too long on the investigation side. It seems to be taking a long time on the evaluation side, and I say that without having seen any of the case file. And it may be that there are reasons and complexities for it, but we need those explained. It would be a lot easier on the public if at least the process was explained. Why the investigation took so long with different things maybe they needed to do to get there, what is taking the time in the evaluation stage, different things you're going to look at, maybe different follow-up interviews you want to do. But the problem is it creates this vacuum where there is no information, and people's frustration can fill that vacuum along with other emotions. My hope is that the review is thorough, but is also done really timely, and that we can get some explanation as we move forward about the whys that it's taking this long. It may be that people agree with it. They want a thorough investigation, but we need some at least explanation of process, and my hope is that this will come to completion very soon. Chris?
Probably for Mr. Wilson, if he wouldn't mind stepping up there, I can ask a question when he gets closer to the microphone. They're about the state fair. Mr. Wilson, Chris Wilson, question is, did the State Fair Board vote on these new regulations and changing the fair?
No, we have not. But the Fair Board is in complete support of all the efforts the governor has done to keep our community healthy. So it's, you know, we had a lot of events planned for the general public, the Midway, the concerts as you know them, but it's really impossible to enforce social distancing at a free concert at the State Fair. So we just felt like it was the proper thing to do to support.
When you say we, do you think it'd be more transparent if the board actually voted on those as a whole so people could see how they voted, that they agreed to this?
No, what would we want somebody to vote against healthy practices? Every single board member is in favor of the action.
And the last question on that is, some people who really want to go to the fair, they'll see the Midway having been closed, and they'll see Kentucky Kingdom right across the parking lot. What would you say to those people who question whether the Midway could be open, knowing that Kentucky Kingdom is right across the parking lot and open?
Well, the Kentucky Kingdom regulations were enforced before I became chairman of the Fair Board, but we have discussed the possibility, and that we really are not going to allow any Kentucky Kingdom people into the fairgrounds. As I said, the fair is only for participants and only people with credentials who are showing animals, horses, cattle, sheep, will be allowed into the buildings. So even though people are able to go to Kentucky Kingdom under their regulations, that doesn't mean they can come to the fair.
Yeah. Thank you. Chris snuck 3 questions in. The decision on the state fair is the right decision. You've got the board chair, you've got the CEO of the organization itself, you got the governor's office, and you have the Department for Public Health that are all in agreement. We are one of the only states that's going to have any fair at all. And to do that, we had to prioritize those events that are at the core of it. Hopefully next year, we'll have the full thing again, and people can have those double fried donut burgers, though hopefully exercise before and after. Tom?
I'm too old to want to know, that's for sure.
Me too.
Speaking of Louisville and the State Fair, making this news today, is there anything new from Churchill Downs for the Derby?
There is no new update on Churchill Downs and the Derby today. We've committed to talking early next week, and we won't have anything new until then. I think both myself and Bill Karstanjian, the CEO and president, I hope I have his title right, of Churchill, agreed that we have enough time to make decisions after early next week, and we can do it with more data. Karen?
What's the status on unemployment claims, and do you have a monthly breakdown of the remainders?
We can get you a monthly breakdown of the unemployment claims. We are making steady progress on the April claims. I'd like to see us make more progress on the remaining March claims. Those are now the most complicated that are left, and they're a small fraction of what they started, but still, those are March claims. And now, that's not a criticism of our staff. They are working really, really hard. We just all want to help the people that are out there and that need our help. We do believe that the pace on those remaining claims, 95% done, virtually all of them. It's that last 2-page letter that's basically almost like a judicial decision or administrative decision. We are now allowed to get extra outside help for that, which ought to pick up our pace there. We've also added, I think, about 40 additional lawyers to make sure that we can, again, crank more of those out. But the federal government requires that last decision. It's a pain in the butt. It means it takes a lot longer at a time when it shouldn't, but we got to do it. Joe. Oh, yeah.
Has there been any estimations about what the state expects to see as far as the hit in economic impact of these restrictions?
There's no question that the scale back of the fair is going to have a large economic impact on the State Fair Board and the operations. Let me say from the state, we understand that, and we're not going to hold that against the group. We want to make sure that we are supportive of it, just like we are with broader tourism, which are all taking enormous hits. We can try to see if there is a calculation of that economic impact, but this is what the virus is doing. I mean, it's just devastating for these areas. Our hope is that we can have an economy that bounces back, though, that bounces back quickly and strongly, especially post-vaccine. But this gives me an opportunity to say two things have to happen for us to have that bounce back. Number one, the current CARES Act negotiations that are occurring between the HEROES Act and the HEALS Act must include state and local government stabilization. Without it, you are not going to have dollars flowing into the economy that have about a 1.5 times effect of other dollars, and we are not going to see us bounce back. In fact, we will have to cut vital services, which will cause more unemployment at a time when those vital services are needed. It'll cause the single largest budget cuts in Kentucky's history. We don't want to see that. Second, they need to extend the additional unemployment benefits. I know there's some argument about 600 or 400. Listen, these dollars right now are continuing consumer activity in our economy, and if we want this recession to be short, it's necessary. I believe it's about $5 million job openings and 30 million people that are out of work, that we can get 5 million people back to work even with those additional benefits. Finally, let me explain something that was raised on the Senate floor the other day, and that was an argument that we don't need additional state stabilization because we haven't spent all of what was initially provided to us. There are a couple problems there. Number one, we're not allowed to use those initial dollars for state stabilization. We can't use those for our general budget, only a couple of small areas, and trust me, we are using them for those areas. Second thing is, different folks in Congress keep saying, well, we might not do a new CARES Act that helps our states, but give you flexibility with the dollars we already gave you. So we got the same Congress saying, why haven't you spent the money? And you better not spend the money because that might be all you have if we give you additional flexibility. And so what that says is we need certainty. We need them to move forward now. We need this to be included in the next CARES Act. And it's not just me, it's every governor. To us, it's not political. It's a matter of survival. Lawrence. Yes. Yes. The question is, will the limit on social gatherings at 10 be extended? And the answer is yes. Again, we are seeing spread in clusters around house parties, and we're asking people to sacrifice the number of people they have over to help us keep our economy open and for the health of our people. And you can have, hopefully, you can have a lot of fun with 8 other people, 10 total, and it's a small sacrifice. Mike.
Regardless of how the virus is, do you foresee expecting mask mandates numerous times included a vaccine?
The question is, do I anticipate extending the mask mandate or the facial covering mandate numerous times until we have a vaccine? I certainly see extending it until we have significant control over the virus, which we do not right now. Just because we're doing better doesn't mean we have control. I'd want to see the positivity rate get well south of 5%, south of 4%. And even then, we'd have to look at the positive impact that it is having and what else we might be able to do that we don't do now. You know, if we extend the mask mandate, can we have more people over to our house than 10 at some point? Are there other capacities we can increase in other places? And I believe what we're going to see is this simple act of wearing a mask can help us do a lot more. And personally, I've talked to a lot of people that were around, exposed to people that have COVID that were wearing their mask, and most all of them have tested negative. It's a very powerful statement on how important it can be. Nick?
Universities, is it just kind of, I guess, an expectation that universities will see cases? And I mean, because I think there's, a lot of universities are doing the best they can, but you have to imagine it's going to happen.
The question is, in our universities, is there a general expectation that we'll see cases? Sure. We see it all throughout the population. It's how they manage those cases that will determine whether the university can continue operating in certain manners, like in-person classes. If it can't be found through testing, and isolated early, and that person is around a whole lot of other people, that can cause some major ramifications. I think we talked a little bit yesterday. If somebody turns out to be positive that went to 4 classes and we have Econ 101, and the 100 people in there, which I hope nobody's doing, and then they go to a big party, what's going to happen? A lot of those classes can't be in person, and even in ones that can, a lot of people can't go because of where they might have been. So I think we should expect cases like we do everywhere. The real challenge is going to be how we react and what that ultimately leads to. Stu?
Following up on this question, UK is now testing students that are returning back to campus. Should all the public universities be doing that?
The question is on UK testing every student as they come back, and should other universities do that? I think that there can be multiple types of effective plans. What UK is doing right now, in a way, is what we do when we have a positive outbreak in our prisons or in these meatpacking facilities, and that's establishing a baseline where you go through for everyone. Now, the baseline is helpful, but if somebody gets it afterwards and spreads it, the baseline doesn't stop that. And so I think there's got to be a mixture of how people are going into it and through it. We want the temperature checks, we want the screenings, we want robust plans by each of our university. All of them need testing capacity. All of them need to have a contract with a group, know where to send people, and to be able to do large-scale testing if needed. Grace.
Dr. Moyer over in Louisville and Mayor Fisher tell people, don't go get a test unless you have symptoms and related kind of guidance. You've been saying, try to get a test as often as you can, once or twice a month. You get them twice a month, correct?
I get tested every 2 weeks.
What do you say to that? I mean, testing capacity is limited now. What message do you want out there right now?
Yeah, the question is on testing capacity, and the message I want out right now. I believe with our new state partnerships with both U of L and Norton, because we're providing several hundred, 500 additional, 700 additional kits to Norton for their forward-facing testing, that we have the capacity to still do community-based testing. And I want to make sure that we learn from the lessons that we've been taught throughout COVID. I remember when we had our very first drive-through location in Pike County, we were still in you need to be a frontline worker, you need to have symptoms, and nobody came. I don't mean nobody, but we were testing in the double digits when we wanted to do 400, 500 tests a day. We opened it up, and we were at full capacity the next day, and we identified a number of cases. I believe that we have to have our testing open to the general public, but also make sure that we can get and prioritize everybody in who's a frontline healthcare worker or who has symptoms. We can do that. And we ought to be able to do that logistically, whether it's reserve certain hours or a certain number of tests per day. We can do both, and we must do both. If we don't have a good idea of our overall community spread, don't have enough testing of the general community, we can't take the effective steps we need to or justify them to the public. Tom?
Governor,
Tom's rocking an Ohio State Buckeye mask today. I like it. I'm not a fan, but you're getting to show your fandom through this. My brother went to Ohio State, so I can't root for him.
well then, I like your brother. Do you have any of the in-person unemployment insurance out in the state next week? Is that been planned?
We don't have an announcement about next week for in-person unemployment services. I believe we will have an announcement for the week after. What we have is a very large group in Louisville all this week. And then what that creates is a certain amount of work that we got to process back at the office for that next week. But we will continue to have in-person services. The moment we catch up or get close enough, I mean, we continue to have lots of claims filed, to believing we're maybe not ahead, but at least not underwater, then we want to make sure we have permanent facilities out there. And our commitment is, I'm going to reopen regional unemployment offices. We will do it, but I can't sacrifice helping the most people right now to make that happen earlier than feasible.
UK just released their first round of numbers just now. It has
Apparently, there's some numbers that I haven't seen coming in from UK. At least one of the positives, at least supposedly, went to a party. Listen, if we want to do this, you can't be doing that. I mean, you just can't. If you love college, I loved college when I was in it. You can't be doing the things that are going to put your experience at risk. And our college kids shouldn't be faced with that. I mean, we didn't have to be that level of responsible, but actions now can kill people, and that's the world we're living through. There's certain times, I think, in our society where folks have to grow up faster than they should have to. I'm seeing it in my kids right now. Now, not being able to go to school, having missed those summer activities, they're in many ways emotionally older at the moment than they should be, and I hate seeing that. But that's what it's going to take to tough it out and to gut it out. And whether it's UK or any other university, if you want to come back and you want to make this work, going to large parties is one of the first ways that you can screw it up and ultimately shut things down. Now, lots of people are coming into state. Listen, they're going to be living in the state for the next certain number of months, if not the year. We need to know if they have it. We need to be able to take care of them. If it impacts our numbers, that's a trade to make sure they get the care they need and to know and to isolate if we have to. So we're going to have that up on the Fair Board's website right after this. But if we can put back up that slide, I'll give you the most details that I can. I believe all of the agricultural-related competitions are going to still be on. The horse show is going to still be on. The things that originally made the state fair. And over time we added the rides and we added the food and we added, we had a senior day at the state fair. And I've participated in senior day every year. When I was Attorney General and talk about scams, that's one good example of why we can't have the state fair the way that it was. So we'll have, I think it'll have a full list up of what is on and what is off, but I would think of the 4-H type of competitions. Those are the ones that we want to preserve. Lawrence.
Along that same line, what happens to the contracts for vendors, entertainment, anything like that?
We're going to work through the contracts for vendors and entertainment along with the Fair Board. We believe we're doing this early enough and based on a worldwide health pandemic to where we believe that we can take all the necessary steps to reduce liability as much as we can. But the liability of exposing potentially that many people if we didn't do it right is also a factor that we have to weigh. But dealing with liability is something that I used to do as an attorney. This is an area that we can deal with, and sure, there's a lawsuit every day about something. I'm sure that we will have some of them. I feel good about the position that we're in. We got good guidance from the Fair Board about when and how decisions needed to be made. I think it was done in a thoughtful manner, and I believe we're going to be as protected as we can be. All right, Monday through Thursday, right now, doing better than we have the last, I think, even 2 weeks. And with an opportunity for the first time at the end of this week to have the first decrease we've seen in probably 6 or so weeks. Let's make sure that we get there. So again, hands, face, and space. Make sure you wear that facial covering. Don't let up Friday or through the weekend. We're going to communicate numbers and updates by video on Friday and then either by video or press release Saturday and Sunday. And then we'll be back here Monday at 4 p.m. Everybody stay safe. Do the things it takes to beat this virus. We can win. Thank you.